Everybody, exactly 10
This
o'clock.
meeting is being recorded.
This is the 26th episode of Tech Forum Pune. Tech Forum is just 10 year old. We have more than 100 members and we have conducted more than 25 such tech talks in past 12 months. It's a group of like-minded technocrats who support each other. We have a cross section of students, scientists, researchers, industrialists, and this is day by day growing with your support and active participation. Today's 26th lecture is by Dr. Sameerkumar Shah, and subject is very much interesting. He has formed a global forum or platform to promote affordable innovations and low cost manufacturing in healthcare. Friends, you are all aware the medication or medical cost is very high, and one of the reason is the equipment involved are imported, and they are imported at premium. The hospital overheads are added, and finally you as a customer land up paying heavy charges for the services those were rendered. Dr. Sameerkumar Shah's innovation and the global forum platform is trying to manufacture these healthcare solutions at an affordable cost, and that is his motto, which is a very noble cause, noble motto, I can say. So cost cutting is one of the prime focus on in the innovations. Today's speaker, Dr. Sameerkumar Shah, is consultant radiologist. He is a founder of Canpic Medical and Education Foundation Pune. He is also chairman Canpic Medical Research and Technologies Private Limited. So we have such a versatile personality. Of course, he is our member, and in the past also he has given presentations on similar topics. Dr. Sameerkumar is trying to create a platform to promote affordable innovations to lower the cost of healthcare services, catalyzed by Indian insurance sector. Low-cost manufacturing in India may help us to create a win-win situation by exporting these devices to other countries, especially to the USA. Dr. Sameer Kumar's Tech Talk will explain about the current opportunities for India to emerge as a low-cost manufacturing hub and to emerge as a global leader. So friends, Tech Forum have taken up this initiative to promote such activities, and we will be having more such activities in coming future. And in medical research or medical innovations, Tech Forum have decided to support Dr. Samir Kumar Shah 100%, and we appeal to all the members, those who are into the medical electronics field, can extend this support. So without spending much time, I will request Dr. Samir Kumar Shah to start his presentation. Over to Doctor.
Yeah, many thanks, Vilasji, for the kind introduction and all the kind words for this activity. And again, I thank Tech Forum and the entire team for organizing this event and inviting me and giving this opportunity. So, the entire team of Tech Forum is growing. It's a very good initiative and very much useful for the participants and the members of this forum. And even Chaitanya ji and other team is doing so well to promote this initiative. Now, let us come to the today's topic. This is a forum or a platform which we are promoting to promote affordable innovations and thereby a low cost manufacturing in our country in healthcare domain. And this will be pertaining to medical devices and medical consumables. Now, again, I have deliberately mentioned that this needs to be catalyzed by health insurance sector, being a market force which is underutilized and a dormant market force. And I'll come to that in details in the subsequent part of the presentation. And again, we are trying to see that we integrate academics, services, and research at innovation clubs in healthcare domain. And this is my organization. Of course, Dr. Kalam is a great inspiration for us, who ignited millions of minds in this country to innovate. And I had a great privilege to interact with him. And he had agreed to be a part of this forum in the form of a patron. And of course, we are grateful, still grateful to him for all his support and guidance then. Now, what are the problem statements in this domain we are looking at through this forum? Now, rising cost of healthcare services is a major problem on a global scale, not just in India. Even if it is in UK, European countries, in America, everywhere the problem exists. Of course, COVID pandemic has surfaced some of the lacunae in the healthcare system in the form of poor infrastructure and other things, especially in developing countries. Accessibility is a problem, majorly in underdeveloped countries. We have poor health insurance penetration, especially in private domain, even in our country. And again, we rely on heavy imports as far as medical devices and consumables go. And again, COVID has again endorsed upon it. The pandemic situation, uh, you know, uh, we had to initially depend on the imports. Of course, later on we have geared up to suffice the needs, and with scaling up of the manufacturing here. Now, why affordable innovation is necessary? Global healthcare industry is estimated to be about $10 trillion in this year. Costs increased by about 10% per annum and 20% for cancer treatment. So, for a cancer patient, he has to pay double the cost in 5 years. About 10 crore individuals are pushed below the poverty line due to the medical expenses. And again, GDP allocation is an age-old demand, and especially in our country. And again, I'll explain how that could be also be sufficed through this particular approach. And most of the patients spend out of the pocket, and there is a huge burden of the healthcare cost on the people. And again, there are traditional approaches in the form of rigorous financial management and efficient operational performance, etc., which are being tried. But again, they cater to a very small portion of the patients in our country. And again, we need some kind of a non-traditional approach. So, what is the current scenario in medical device segment in our country? And a WHO report says that most of these devices are, ideally, suitable for developed countries, and they are either maladapted or unaffordable in developing countries. And again, we need to develop these customized kind of technologies which are suitable for those respective countries. As far as India goes, 80% of the devices are imported, and there is a demand supply mismatch and again kind of oligopoly situation here. And the market is dominated by America and Europe, which caters to about 75% of the market share. And in Asia, China dominates, which has a market share of 18%, and we have a share of about 1%. So this is the current scenario. So where we have to really gear up and do a lot of work in this domain. Now, on the other hand, 75% of the world's population has no access to any diagnostic imaging. For example, they do not know what is a X-ray, what is a ultrasound. So if we go to some sub-Saharan underdeveloped countries, there this problem is majorly seen. Now, again, what are the challenges to innovate and why? Where is the problem? So again, what are the sector, the medical device sector faces some challenges, wherein we have very poor indigenous manufacturing. Again, there are unmet funding requirements. And for research and development, we need grants rather than loans or any other kind of funding. And again, it should be available from various sources, not just government funding from Department of Science and Technology or Biotechnology or ICMR, but from other segments also the funding should come in. And there should be greater CSS funding spending for innovations. Again, this is an area where there is a scope to improve further. Now, there is a huge process of brain drain, and a lot of our innovators, brilliant scientists go abroad and they innovate there. And of course, they come out with successful products which definitely make a difference to the disease diagnosis and management. And again, problem is that the R&D costs, research and development costs in these countries, let's say in America and Europe, is comparatively high. And again, it results in importing, high cost devices to our country. So this is a kind of a vicious cycle which we can break. Again, we need to upgrade our ecosystem, innovation ecosystem in our country to come up with a lot of innovations in the medical device sector. Now it's a 400 billion industry globally, and Indian medical device industry is about 3.5 billion. And again, it contributes less than 5% of the India's 100 billion healthcare sector. Now, why we require an affordable innovation? Again, the why the cost is rising. We have to see that there is growing and aging population is there, and somebody just mentioned that of course they were primarily working for the elderly individuals in the society. So chronic illnesses are also increasing. Lifestyle induced disorders, diabetes mellitus is we are going to be a capital of the world as far as diabetes goes. Embedded costs are increasing, and health insurance premiums are rising. And again, of course, there are other factors also. And treatment is not seeked at early stage. Now, of course, I believe that the healthcare sector has to be equally proactive to see that we reach out to these individuals in the form of simple and cost-cutting innovations, affordable innovations, and the things may definitely work out and made acceptable to the masses. Now, dependency is there on the medical devices, and we heavily rely on imports. So what is a affordable or frugal or disruptive innovation? These are need-driven innovations which meet the needs in resource-poor settings without compromising the quality. And Jaipur Food is a good example. And it could be a new medicine, a drug, a vaccine, a diagnostic method, a drug delivery system, mobile-based application, which is very common nowadays. Medical devices, these any equipment, and these have to be essentially accessible and well created. Now, who is to be involved? Now we have to involve different stakeholders like investors, government agencies, and some private sectors, venture non-profit organizations, like in the voluntary sector. So we have to involve all these stakeholders, and we have to see that medical professionals, are involved, and they should feel that this is a career option for them, and that is how we are trying to create a kind of a conducive ecosystem wherein they can feel that yes, there is a career in innovation. Now, what we are trying to do, we are trying to create this kind of a platform on a global scale, which works 24/7, as against many hackathons and other, idea challenge programs, which work, once in a year or something. So all kinds of stakeholders from various sectors, as we discussed, would be involved. There would be an idea challenge program. Idea challenge program involves a repository of or posing health challenges from different parts of the world, and inviting solutions for these challenges, something like a lock and key model. And innovation clubs, we are trying to request to see that these kind of departments or activities are involved in hospitals and medical colleges or any health establishment, so that these become engines of innovations and to drive the economy for that organization. So these are some of the features or the activities of this particular forum which we are trying to undertake. And definitely most important, health insurance sector being utilized as a catalyst and a partner for cost stabilization and other goals. Now, just to give a kind of a chart which would mention about how the this particular forum will work, and wherein we have, let's say, innovative concepts and ideas, and there are innovators, we can reach out to them rather than innovators reaching out to other stakeholders for their requirements in the form of funding or any kind of IP advisory or anything else. So we have to reach out to them. So it is a two-way process which we are trying to undertake. And again, we can involve global partners for various purposes like funding, IPR services, technological support, or any kind of partnerships or alliance. And again, these stakeholders would be involved, and there would be good amount of networking and lateral thinking, and this would definitely take the activities onto a next level with early and fruitful outcomes. And the impact would be in the form of cost-effective solutions with significant macroeconomic impact and better health outcomes. Now, again, why this model? How, especially in our country, how this will work? Let's say project is there which has better clinical outcomes and it has a better socioeconomic impact. So these kind of projects could be supported by somebody from non-profit sector, somebody like a venture philanthropy of a venture philanthropist, and definitely they would be able to sustain ignore the early financial outcomes, and definitely the activity or the project would go on to a next level. So maybe at a certain stage it would be a successful business venture, but till then these stakeholders could be of immense help to support this particular activity or a project. And of course, as I said, that we have to have an alternative support in the form of funding or any other resources. So why this approach is necessary? Because this will attain health outcomes as well as financial goals in long run. And there would be some, support for high risk research and development projects in healthcare. And this avoids risk taking by corporate sector at an early stage. And yet they can support the project at a certain stage, at a later stage, and enjoy the financial gains. Non-profit sector could promote or complement the private sector and help in reducing the cost of aggressive marketing and other expenses. And definitely, this would in turn create wealth. And again, at an affordable cost, the innovation itself would be affordable, being developed in our country, which we are definitely known world over for cost cutting in any project and coming up with the outcomes in lowest possible resources. And this creates a win-win situation. Now, what are the barriers we are facing? Of course, it is always good to talk about plans and activities, but we definitely cannot ignore the barriers which our innovators, our entrepreneurs are facing in our country. Now, again, funding is a major rate limiting step for any organization or any project to go ahead. So herein, we can get a like-minded partner. Let's say health insurance sector wants to go for cost cutting for cancer, and they can definitely come up with some kind of a support, funding support for suitable projects, and definitely take the activities onto a next level. And again, as I said, the philanthropist venture philanthropy needs to be geared up in this part of the world. I just interacted with some doctors recently who are working as cancer surgeons, and they have cancer survivors. Now they could be a good this pool could be a good activity. These people could become venture philanthropists because they are cancer survivors and they have gone through that experience. So these kind of activities, although they are discrete, we need to organize them and bring on this platform and to scale them up. So this is how we can overcome certain barriers. Now, who's who? It's a very important question. We do not know. Now, since the tech forum is, inviting all these participants for this particular meet, that's how we are coming to know that who's who and who's doing what. So this is very important. So this platform will give that particular information to the information seekers, all the innovators, and all the stakeholders, so that again, herein we will promote that lock and key model. So again, we are using, we'll be using advanced technology for connecting people and networking. And again, this is how we overcome the barriers. So just to mention about the Idea Challenge program, for example, Ebola virus is not a major problem in our country, but it is a major problem in Central Africa with 50% or more mortality, and there is no definitive treatment, although there is a vaccine, and it leads to defects in the fetuses. And let's say we can come up with some kind of a solution for that. Our entrepreneurs, innovators definitely can take this challenge, and there are similar so many challenges in different parts of the world. And this Idea Challenge program is going to open up thousands of opportunities for our entrepreneurs. And definitely we have a talent pool which can give solutions to these problems. So I just mentioned about an innovation club. Now, this particular department would not have any expenditure on the part of the healthcare establishment. There would be monthly meeting of all the interested innovators and related stakeholders, like those counterparts from engineering or physics or biophysics domain, and they have to meet at their institution, maybe in the hospital, once in a month. Maybe they could be undergraduate, postgraduate students, or faculties or consultants. And this activity would, generate a lot of projects, ideas, and they could be taken on to a next level. If there is a local support, fine, well and good. If not, then they can submit these ideas on this global platform, wherein this would act as a window to the entire world, and they will definitely get some kind of a support to take their activities on to the next level. And again, in future, at certain institutions or hospitals, we can convert these innovation clubs into um, the uh, this could be incubation centers, and these incubation centers definitely would again drive. We have very few dedicated healthcare incubation centers in this country, and I think 2 3 years back there was one started in Delhi, and we need many more such centers, and they have to be in the vicinity of the hospitals or medical colleges, wherein the interaction becomes more and more, and on a regular basis, because it's very difficult for a doctor as an innovator to participate in such activities by taking out their time and visiting these centers. So this is the whole idea of starting the incubation centers. Now, another policy matter which we are working, which was really appreciated by World Bank Group and various other organizations, like Niti Aayog and National Health Authority, there the integration of healthcare services, academic and research is essential in our country. I'll just mention that through these innovation clubs, which would be there in the institutions and hospitals, we are very dominant in healthcare service domain. We are good at medical education. R&D is going on, but again, it's a very comparatively smaller domain, and these are all are discrete. So once we integrate, that means we can utilize the infrastructure being used for service domain and the human resource or other resources, and we could utilize it for academic or R&D purpose, and we can come up with cost-cutting innovations, which would lead to cost stabilization and also wealth creation on the other hand, very important. So these are the engines which will make the hospitals sustainable in long run. So we have to see that we have to increase the revenue which is coming from R&D, and this it could be utilized to cross-subsidize the needy and poor patients and the needy medical students. We have come across that recently, that with the Ukraine, crisis, that a lot of medical students had to return to India, and they are searching, for opportunities where they can get, low cost medical education. So this kind of an approach would definitely help them also, the students also, and of course, every sector will have its own share and opportunities. But we are just trying to see that, we also create, opportunities and all these kind of support for the students who are not able to afford the medical education and yet want to go for it. So cross subsidization and this kind of an alternative revenue model needs to be evolved. Now, why Innovation Club? Uh, how it will support and sustain other activities like public health insurance scheme. We have these various very famous public health insurance schemes like Ayushman Bharat or PMJY scheme in India, and Medicare or Medicaid is a scheme there in America, and we have National Health Services. Of course, it is in service domain in UK. Now, wealth creation and cost stabilization is the mantra, or this kind of approach would help us in sustaining these kind of projects and activities in long run, and also we can, achieve the goals which these schemes have set. And again, uh, it will be very much useful in long run to make these activities successful. Now, what will be the impact? Economic impact would be significant. There would be wealth creation through these affordable innovations, and definitely there would be impact on manufacturing. So, what happens now? Innovations lead to manufacturing, definitely, and we have that again, capacity to manufacture on a larger scale, provided these innovations are coming up, and this will, uh, again, we can come up with cost-effective solutions again, as we can export these devices on a global scale. So this will benefit all the sectors, not just public sector, but in private sector also, and even the private health insurance would be made affordable through this approach. Of course, there is a great scope for softwares for disease prevention and to reduce the cost also. And of course, a lot of startups in India are working on that. I'll just give an example. Now, this is a kind of a vessel in the neck, what we call carotid, and we can do a sonography, and we can measure certain parameters. And I'll give an example. There is something known as familial dyslipidemia, which is a genetic disorder, which is very highly prevalent in this country. There are no authentic studies, although so the prevalence is roughly estimated to be more than 15% in the population. So the risk for premature cardiovascular disease and like developing heart attack or any other complication, maybe 10 to 15 or 20 years earlier, is very common with this kind of a disorders, and there is 100-fold more risk. So we can screen these individuals, and they have something like xanthelasmas. These kind of white spots are there on their eyelids, around the eyelids, and certain parameters, simple parameters we can measure, and we can go for prevention with a very regular and a routine and aggressive prevention protocol. This is very much needed. This is an example, and we can come up with various softwares for this kind of a sonographic test. Another example I can give is that, of course, software being developed for this would be of immense help. But the problem is I would like to endorse is that why we have to focus on local regional health issues as well. Herein, birth defects in babies are common again, and this is a Western protocol which has been followed by our country since many years. And there are 6 lakh babies with this kind of a problem which are born every year, as against 35 lakh premature births are there in India. Now, this is a huge, huge number. And there was no program as yet. And our association has started this program wherein we call it Sameerkumar, and wherein we really protect these babies by adding on something like a color Doppler study for a couple of times in pregnancy. And this definitely can prevent, we can start treatment to prevent low birth weight babies. And of course, this is a major problem in our country. The babies have to be put in incubators, and there is a long period of hospitalization wherein the entire family is involved, and it leads to a lot of morbidity and again mortality. And herein we can really prevent this. Now, what is the role of health insurance sector? High treatment cost results in high claim cost, which in turns results in high premium. So this is a vicious cycle again, and that precludes the penetration of business. Herein, what we can do, affordable innovations would definitely reduce the cost and benefit the sector with business growth. And rather, health insurance sector can direct the innovators to focus on high cost priority areas and the major health challenges which are faced by them and the patients. Now, they can directly support certain uh, programs by going to the industry, like prevention through Center of Excellence or some similar activity, and there should be funding provided by them. Now, this is a very important thing. If you have to see that we attain certain goals, we have to utilize the market forces. And again, ultimately, in an open economy, market forces decide how the market will go and in which direction we head. I'm sorry, it sounds like I'm talking a kind of a capitalist kind of a approach, but it is not so. Here, in fact, our intention is to see that underutilized and a dormant market force like health insurance sector should be utilized, and they should directly support grants, give grants and support all these innovations with something like CSR fund. And there should be incentives for the healthcare service providers, which go for cost reduction. So these programs could be designed, and this is how health insurance sector can really promote these kind of affordable innovations and affordability in healthcare. Now, just to give an example, annual health insurance spending in America is about $3 trillion. They've settled these claims and annually, and 1% cost reduction would save around $30 billion annually. So herein, we as a country and our talented innovators, entrepreneurs have a great scope to work at this. And there are success stories. This is not just theory I'm talking about. This is a company based out of Pune, and it is exporting US FDA approved patented products. And the cost reduction is by 20%. And with a 2% market share, which is there today, they can save around 16 million US dollars. And with 20% market share, they may save around 160 million US dollars. And this is an example of a low-cost innovation and manufacturing by an Indian company with significant economic impact globally. And this creates a win-win situation for service providers in healthcare, patients there, health insurance companies, all in America, and a medical device company which is based in India. So this we have to, see that this kind of activity is promoted, and we scale this up in the form of many more companies coming up, which create a significant economic impact due to low cost manufacturing and exports. So organized effort is necessary by these companies and these organizations, and this is how we can create a win-win situation. So I appeal to all the participants here that please try to see that these companies come up and they really can make a significant impact in future. Now, the cost of treatment in America is quite high as compared to our country, and of course, there is a necessity of cost reduction. And again, to mention where we have an opportunity, angioplasties are being done. Of course, the stent cost could be produced. And again, we should not have that kind of a thing, pessimistic thinking that again quality is factor, a US FDA approval is a factor. So how do we overcome these barriers? Eventually, things will happen. I've just given an example how these a company which is based in Pune, which exports the spinal implants, has got FDA approvals, and they are doing very well in a way. So even joint replacement surgeries are being done. There again the implants are cost. The here we have an opportunity. Again, for cancer and other disorders, we can go for early detection. And again, disease like diabetes, we can go for prevention at any level, primary, secondary, or tertiary. Secondary and tertiary prevention, I mean to say, is that we can prevent the complications and thereby the cost of the disease. And again, they spend around $350 billion for treatment of diabetes. So again, these are huge opportunities for our innovators. So just to summarize, affordable innovation plays a greater role to reduce the cost of service or a product, making healthcare simple and affordable. And again, we need global forum or platform to promote affordable innovations and low-cost manufacturing. And it's a need of an hour. And it will open up global opportunities, as I mentioned. And health insurance sectors must act as a major catalyst, and being the only market force for promoting similar activities. And we have to come up with innovation clubs. And this would definitely support the service and academic domain through cross-subsidization. We can, again, support or complement health insurance schemes like Ayushman Bharat or even similar schemes world over. And definitely, we can also take care of the public health care programs like NHS in UK. And we definitely have a potential to become a low-cost manufacturing hub. And thereby, we can truly promote Make in India and become self-reliant in long run. So I thank all of you for attending this particular webinar and on the Sunday morning. And these are my contact details. Please feel free to contact me at any point of time. And I'll be very glad to, take the things ahead jointly with any of the members of this forum or the attendees. And again, I thank the Tech Forum for this opportunity. Thanks a lot. Thank you.
Thank you, Doctor, for wonderful presentation. We'll open the question and answer session. Request participants to identify their name and then ask the questions. So please go ahead with your queries.
Well, Dr. Sameerji, very good morning.
Yeah.
This is Dr. Desai here from Symbiosis. Sir, from the point of grassroots innovation and joining hands with higher education institution to take it to the next level, whether your foundation has something charted out in a win-win situation, or we can establish a chapter in university level so that we can have student interns at lower cost to work on your innovation or your ideations?
Yeah. Thanks a lot for this question. This is a very important and a practical question. Basically, I'll be very glad to collaborate with your organization or any other organization, as a matter of fact. And if there are interns or the students, if they are participating, we'll be very glad. And we are trying to establish this particular forum in a way. It's in process. So I shall be very glad. And as you rightly said that what exactly is being done. So we are establishing this global forum. And this will not work only at a university or a local level, but we want to see that this becomes a truly global kind of a forum wherein all the stakeholders can interact and, they create a win-win situation.
Well, Dr. Sabirji, it's really nice to know that you are open for certain collaborative opportunities. What I will do is I will have a discussion with my higher authority or management, and definitely I will fix up a meeting and let us see the possibility of joining hands, and if possible, we'll have a forum at our campus and accessible to all, not for our own campus premises.
I'll look forward for your
sure, sir. I'll get back to you. Yeah. Thank you. Thanks a lot.
Yeah, next question, please. Please go ahead. Sujata, do you have any queries?
Dr. Sameer, this is Sarolkar.
Hi, namaskar, namaskar.
Namaskar. As we discussed 2-3 days ago, if you have any project for cost reduction or new innovative projects like pre-filled syringes or something else, we can definitely support you in the activities. And I look forward for joining hands to make new innovative products in India. The technology is already available with us.
Yeah, definitely. Definitely. Thank you.
Thank you.
Thank you, Mr. Sarokar, for such a wonderful support. Any further question? I think Dr. Sujata Lemay is representing Senior Citizens Group. So I don't know whether she has any comment. Sujata, madam, do you have any comment? Oh, looks she has left. Okay. Any more questions? Please shoot out.
Dr. Sameer.
Yeah.
This is Sarolkar here again, once again.
Yeah, please.
Nowadays joint replacement is happening in a big way in India.
Yeah, true.
And all these joints, they are all coming from overseas. Even if you see the dental implant, the implants are also coming from overseas, and the cost of dental treatment is skyrocketing. So if you have anybody who is interested making all these dental implants or robotic joints and all, then probably we can work together. This should be
definitely.
A very
I have somebody who has developed
go ahead.
Yeah, definitely. I know dental surgeon who's an innovator who has developed a brush biopsy device already, so I can always connect both of you there. And there is one more innovator in Mumbai, I know, who is a dental surgeon. So these couple of definitely people could be of your interest, and I'll connect both of you.
This is definitely a necessity, because one implant, if you want to do nowadays, it is costing about 40,000 rupees, which is definitely not within the reach of every person. And our aim should be that this kind of treatment should be affordable by each and everybody. And if the volumes are there, I'm sure it will be affordable.
Definitely. And most of the health insurance companies do not cover dental treatment. So that's another challenge and major problem here. So definitely,
Thank you.
Thank you.
Okay. Thank you. Any more questions, please? Looks there are very few questions. Either the subject is well understood or people don't want to make any queries. Anyway.
Sir, sorry to interrupt here.
Yeah.
This is Praveen here once again. Sameer ji and Tech Forum. Sir, how you would like to take it to a government level? Are you looking for some sort of CSR funding under the initiative of Niti Aayog or maybe I would say Atal Innovation Mission? Or you are directly connecting to a corporate circle for CSR funding for this grassroots innovation?
Pravinji, both options are open. We are open for any kind of support because ideally, essentially, we want to keep it as a non-profit activity. And of course, we had some interactions with World Bank Group and other organizations. Again, their view was to make it entirely commercial. But again, that is the reason we stopped. But although they were very positive with the whole plan and the activity, and we'll be very glad if we can. Of course, we had some meetings with Niti Aayog National Authority also. But again, this has been happening because of the COVID pandemic situation. The entire focus was primarily on COVID and related activities, perhaps. So we are again trying to reconnect, and if we can work together, nothing like it.
Sure, sir. Sure. It's really nice to know your thoughts on this, and definitely we will take it ahead. Thank you.
Praveen sir, my name is Anil Chaitanya. I'm a part of Tech Forum. I work in this area for quite long. Now your question is how we are going ahead with government and CSR funds for financing. The actually correct answer is Sameerkumar Shah sir has created a forum, and forum has already connected with Niti Aayog and various government at various level, including state and national level. Basically, through this forum, we can support for policy making, but for individual, we can support for financing and funding. So such type of requirement need to be discussed on the forum when across the table, and can we find out various solutions. That's
exactly, sir. Exactly.
So thank you for nice questions being asked here. Thank you once again. Sir, please, sir. Sameerkumar, sir. Anything you want to comment on this?
No, I'm really thankful to all the participants, especially Sarukar and Praveen ji, for all their willingness to cooperate and connect and take the things to onto a next level. So really, I'm thankful to them, and definitely we can together take the things ahead. Yeah.
Okay, thank you, Doctor. If there are no queries, I will conclude today's session. Thank you very much for this initiative, and I think you have two supporters at least, Mr. Sarukar as well as Dr. Praveen from Symbiosis.
Definitely.
And these are two big assets for the movement what you are dreaming. And yeah, go ahead.
So thanks to the Tech Forum